Hi, everyone. I want to talk about healing. Healing has always fascinated me. I guess for 20, 30 years longer, I've been investigating exactly what gets the healing process going. It's not straightforward at all. I was thinking on my walk this morning about near NDEs, near-death experiences. I know that most people, when they talk about their near-death experiences, they talk about the amazing things that happened to them and how they met God or Jesus or some other spiritual revelation that they had and how they were taken. But for me, the real interesting part of it is, I love the stories, by the way. I really do love the stories. But one of the interesting things, I should say, what really interests me about that is the way that they return from the dead, as it were. Most of them die, their heart stops or their brain seems to shut down even, and they even sometimes certified as dead, and then boom, they come back, and their whole problem disappears. That's fascinating, isn't it? I mean, that should fascinate us, and I'm not sure why the medical profession tends to be dismissive of it. Of course they're dismissive because they don't like the story of what happens to people when they pass over to the other side and then come back with this incredible story. But that shouldn't distract from the fact that actually these people had serious illnesses, like one lady who wrote the book about cancer and how she was terminal and died and then returned. And then the cancer disappeared completely. Now, that's fascinating to me. And it's not just one case. There are hundreds of cases of people with near-death experiences who have crossed over or died and returned, and the illnesses have disappeared. Now, isn't that fascinating? I have some personal experiences of it with a family member whose kidney shut down, whose heart stopped, and he was, imagine kidney shut down. He hadn't urinated for 5 days. There were a lot of people who prayed for him. I get that. But nevertheless, his kidneys had shut down and he returned, and it's now more than a year ago, and he's, looking amazing, actually. So we all have stories like that. I have personal stories of a serious back pain, so bad that I couldn't even move my finger. It caused my back pain to be aggravated. It started acutely, and the next day I had a teaching course for 5 days, and there was no way that I could stand up and teach. And at 4 o'clock in the morning, when you're desperate, I prayed. I said, please, God, help me. I really have to deal with this pain. And I hear a voice, yes, ladies and gentlemen, I heard a voice telling me to ask what love is. Love? I said, are you telling me that the pain I'm trying to get rid of is love talking to me? And the answer came back, yes, there's only love. And I was so overcome with that I fell asleep, and when I woke up, the pain was almost gone. And I was able to teach for 5 days. So, that's a miracle. It wasn't a near-death experience at all, but it was a miracle. And we know lots and lots and lots of miracles. I've seen a patient with prostate cancer spread all over his body, disappearing overnight when he got married. So we have lots of examples like that. So what then is healing all about? And who initiates the healing? And how do we understand these miraculous healings? And as I often mention, placebo response. We know the placebo can heal. So do we need surgery? Do we need drugs? Do we need any therapy when that can happen? And I can't really answer that question, to be quite honest. I think that all the things we do and the things that people go through are somehow part of this healing process, but how do we initiate it? And that's the puzzle. I can't really say. I mean, when I talk about the principles of healing, I think there are some principles. mean, I think that lifestyle is really important. And yet, my wife's father, for example, he died at the age of 92. He had spent half his life smoking. He loved ice cream and sweets. Yeah, he died at 92 of esophageal cancer, but thank you very much. He enjoyed his life all the way through. Was on drugs for a range of diseases. And his wife also died. I think she was more than 92 even. And she also had a range of quite serious illness. She had a form of blood cancer. And she lived a long time. So what I'm pointing to here is that nothing is straightforward when it comes to healing. I think lifestyle is important. But we all know people that have smoked and eaten badly and live a long life. I'm smiling now because I'm just remembering there was a little story about these two health fanatics who really ate well and did the exercise and everything and died somewhere in their 60s. Whereas Colin Sanders, or his name, the one that started Kentucky Fried Chicken, he loved his Kentucky Fried Chicken. He lived to be 92 also. So, so it's not straightforward, this healing process. And as much as I am a health practitioner, I mean, my first book is called Healthy Medicine. So as much as I am a health practitioner, I do recognize that we're dealing here with a great mystery. And I think we do need to listen to our own inner voice and our own inner stories and do whatever seems to be most appropriate. As I said, I think lifestyle is important and the food choices you make are important. And yet this morning I see on my email a whole talk on why meat is healthy, and that the whole story around vegetarian and vegetables wasn't based on good science. That vegetables are more important than meat, and we should stop eating meat. I think that the answer to that is that we're dealing with unique individualities. Each person is totally and absolutely unique. And there's a question of genetics and a question of what Buddhism calls the karma we carry with us, we bring into this world. Information and energies that have consequences, either supportive or negative. So I think there is something to the story of karma. I think there's something to the story that we're on a journey, and that whatever's coming up is journey work, actually, and that the journey that we do and the decisions we make is more important than anything we can do. That's also true. So, yeah. So while I believe in lifestyle, and I do follow lifestyle, I think when it comes to food choices, I'm not vegetarian, nor do I eat a lot of meat. We eat meat maybe a few times a week, but we love our vegetables. So, and certainly when a person has a serious illness, I tell them to go into 100% vegetarian diet for a few months, not forever. A few months, because I think vegetables are like herbs. They're cleansing and they're easy for the body to digest. But I'm not against meat at all. So, yeah, so lifestyle is important. Remedies, are they important? I take 30 capsules a day. So I obviously think that they are important. But they're kind of gifts. They are, yeah. I think each person needs to make these decisions on their own. I think that the remedies are really important and I treat them as important. But again, I think that the science around it is very confusing. So be careful of the science. Read the science. Make your own decision based on what your body's asking for. Yeah, and enjoy your life and smile all the way. Okay, have a good day.